Kids across the country are heading back to school, and so are the germs and other health concerns. But parents can take precautions now to make sure their children stay healthy and safe all year long. ABC News medical contributor Dr. Alok Patel is here now with a few tips and tricks. Doc, hello. You have a checklist for parents. Yeah, give me some of that. Sunday. You have a checklist for parents as their kids head back to school. What should parents focus on?
Barry, I'm all about the checklist. It seems extensive, but as millions of kids go back to school, we want to make sure they're doing so safely. So I'm going to break this down into three little categories for parents. First part of the checklist is before school starts. Have you checked in with teachers, the principal? Do you understand the school safety plan, emergency protocol? Have you checked in with the pediatrician, those back to school physicals, making sure vaccines are up to date? And also try to get into that routine of bedtime and wake up before school starts. Next part of the checklist is getting to school, making sure that parents understand the bus route, safety mechanisms in place, making sure there's a safe walking route if your child is walking. We usually don't recommend that kids walk on their own until they're around 10 years old. That's about 5th grade. Or if your kids are taking a bicycle like I used to, please wear a helmet. Unlike kids back in the 80s and 90s, helmets save lives. And then last is at school. Let's look at nutrition plans at school, making sure your kids have healthy snacks. If your kids need any items at school, such as a reusable water bottle, sunscreen, bug spray, and last but not least, emergency numbers and any medications your kids may need, an inhaler, antibiotics, an EpiPen, to make sure the school nurse knows about that. If you need a doctor's note, we got your back.
So what's happening with this backpack weight thing? I'm hearing some backpacks weigh as much as 50 pounds for kids. How heavy is too heavy?
Listen, Perry, some people tease me because I'm like a proper backpack form activist, but I'm just looking out for those little shoulders, necks, and backs. So this is my daughter's backpack. Yeah, we have a TV prop. This should not weigh more than about 15% of your child's weight. We want to make sure kids are using both straps when they wear it. I know back in the day we try to be cool and wear it with one strap. Your shoulders do not think that's cool. Make sure the backpacks are snug and the top of the backpack aligns with the top of your child's shoulders. And you know what? A backpack that has multiple compartments is better weight distribution. If your child needs a weight strap, that's a waist strap, that's also a great option. But you'd be surprised how many kids I see going throughout my day wearing improper backpacks, and I worry about those backs and those necks.
Proper backpack form activist fits nicely on a business card, I think.
I'm just saying.
All right. And then a recent study highlights just how many preschoolers with ADHD are getting treatment with medications, and this may not be following guidelines. What can you tell us?
You know, this really highlights kind of a disparity, Perry, between the diagnosis of ADHD in these young kids and then getting prescription medications a little too early. So this study found that about 42% of kids between the age of 3 to 5 after a diagnosis of ADHD were getting prescriptions within 1 month. The guidelines state that we want to try about 6 months of behavioral interventions before kids take a stimulant medication. Now, we understand that there may be some issues with awareness and education, but also for all families, they may not be able to actually get access to a therapist or these interventions and may actually still choose to get a medication after hearing the risks and rewards. And the last thing I want to add, I know people out there may think, hey, my young child is hyperactive or impulsive. Maybe they have ADHD. It's not a term to throw around lightly. If you are concerned, go and talk to a healthcare professional and look to see what options or diagnoses may be applicable to your situation. And with that, happy back to school to millions of people. May you all stay safe, healthy, germ-free, and with properly adjusted backpacks.